Carbohydrates, Applied Nutrition and Dietetics. Look at these pictures, mainly for nursing students. The food items, carbohydrates, Unit 2. Contents 1. Introduction to carbohydrates, composition, starch, sugar, cellulose, then recommended daily allowance, RDA, dietary sources, functions, three energy, unit of energy, kilocalories, basal metabolic rate, BMR, factors affecting BMR, 4. Significance of BMR in nursing, 5. Conclusion. Detail going on. Introduction. Carbohydrates are essential macronutrients that serve as the primary source of energy for the body. They are found in wide variety of foods, including fruits, vegetables, grains, and dairy products. In nursing, understanding carbohydrates is crucial as they play a vital role in providing energy for cellular functions, supporting metabolic processes, and maintaining blood sugar levels. Educating patients on the importance of carbohydrate intake and making healthy dietary choices can promote overall health and well-being. Second, carbohydrates is condensed here. Definition. Carbohydrates are a class of micronutrients found in many food and beverages. They are one of the primary sources of energy for the body. Chemically, carbohydrates are organic compounds made up of carbon, hydrogen and oxygen atoms, typically with a hydrogen to oxygen atom ratio of 2:1 as in water. They are categorized based on their structure into simple carbohydrate sugars and complex carbohydrates, starches and fibers. Composition. Carbohydrates can be broadly divided into three main types. 1. Sugars. Monosaccharides, the simplest form of carbohydrates. They consist of single sugar molecule and include glucose, fructose and Galactose. Monosaccharides are the building blocks for more complex carbohydrates. Then glucose, also known as blood sugar. It is a primary energy source for cells. Fructose, found in fruits, honey, and root vegetables. It is the sweetest of the nutritional sugars. Galactose, found in milk, dairy products, combines with glucose to form lactose. Disaccharides, composed of two monosaccharides molecules. Common disaccharides include sucrose, lactose, and maltose. Functions: provide immediate energy from structural components of cells and serve as building blocks for more complex carbohydrates. Second, starch. Polysaccharides, complex carbohydrates that are composed of long chain of monosaccharides, units linked together. Structures are the stage form of carbohydrates in plants and are major components of the human diet. Amylose, a straight chain polymer of glucose, units found in starchy foods like potatoes, rice, and corn. Amylopectin, a branched chain polymer of glucose units also found in starchy foods. It is more readily digestible than amylose. Starches are broken down into simpler sugars by enzymes in the digestive system before being absorbed into bloodstream. Functions of starch: serve as energy storage in plants, provide a sustainable release of energy when consumed, and are a significant part of a balanced diet. Three, cellulose fiber, a type of polysaccharide that is not digestible by human enzymes. Cellulose is the main component of plant cell walls and provides structural support to plants. Dietary fiber includes both soluble and insoluble by fiber. Soluble fiber dissolves in water to form a gel-like substance and can help lower blood cholesterol and glucose levels. Insoluble fiber promote the movement of material through the digestive system and increases stool bulk, aiding in digestion. Cellulose is composed of glucose units linked by beta 1 for glycosides bonds, which cannot be broken down by human digestive enzymes. Functions: promote healthy bowel movements, helps control blood sugar levels, lower cholesterol, and aids in maintaining a healthy weight. Understanding carbohydrates and their various forms is crucial for making informed dietary choices and managing energy levels effectively. Recommended daily allowance RDA for carbohydrates. RDA for carbohydrates is set by various health organizations to ensure adequate intake for maintaining optimal health and energy levels. The RDA can vary based on age, sex, and life stage. Here is a detailed look at the RDA for carbohydrates. General recommendations: first, adult and children over 1 year. The RDA for carbohydrates for adults and children over 1 year of age is 130 grams per day. This amount is based on the average minimum amount of glucose utilized by the brain. Second, pregnant woman. The RDA for pregnant woman is 175 grams per day. This increased amount supports fetal development and provides the necessary energy for the growing body. Three, lactating woman. The lactating woman, the RDA is 10 grams per day to account for the energy cost of milk production and to ensure sufficient carbohydrate supply for both the mother and breastfeeding infant. Percentage of total daily calories. The institution of medicine recommended that carbohydrates should make up 45% to 65% of total daily caloric intake. This means for a person consuming 200 calories per day, 900 to 1300 calories should come from carbohydrates, which translates to approximately 225 to 325 grams of carbohydrates daily. For a person consuming 2500 calories per day, 1125 to 1625 calories should come from carbohydrates, which is roughly 281 to 406 grams of carbohydrates daily. Fiber intake. The adequate intake for fiber, a type of carbohydrate, is also set. Men 38 grams per day up to age 50, 30 grams per day over age 50. Women 25 grams per day up to age 50, 21 grams per day over age 50. Children's 19 to 31 grams per day, depends on age and sex. Pregnant woman 28 grams per day, lactating woman 29 grams per day. Special considerations. First, athletics and highly active individuals. Individuals with high levels of physical activity may require more carbohydrates to replenish glycogen stores in muscles and liver. The carbohydrate needs can range from 6 to 10 grams per kilogram of body weight per day, depending on the intensity and duration of the activity. Second, people with metabolic disorders, example diabetics, carbohydrate intake should be carefully managed to maintain blood sugar levels within target ranges. The specific needs should be personalized based on the individual's metabolic health, medication regime, and overall dietary goals. Three, low carbohydrates and ketogenic diets. Some individuals may choose or advised to follow low carb or ketogenic diet for various health reasons. These diets typically reduce carbohydrate intake to 20 to 50 grams per day to promote a state of ketosis where the body uses fat as its primary energy sources. The RDA for carbohydrate provides a guideline to ensure adequate energy supply and support bodily function. It is crucial to tailor carbohydrate intake to individual needs, considering factors such as age, sex, physical activity level, and specific health conditions. Emphasizing a balanced intake of high quality carbohydrate sources can promote overall health and well-being. Dietary sources of carbohydrates. Carbohydrates are found in wide variety of foods, both natural and processed. They can be broadly categorized into simple and complex carbohydrates, with dietary sources varying accordingly. A. Simple carbohydrates. Simple carbohydrates consist of monosaccharides and disaccharides, which are quickly digested and absorbed by the body. First, detail about monosaccharides. Glucose found in fruits, vegetable, honey, and corn syrup. Fructose found in fruits such as apple, oranges, berries, honey, root vegetables like sweet potatoes. Lactose found in dairy products are part of lactose. Second, disaccharides. Sucrose, commonly known as table sugar, found in sugar cane, sugar beets, fruits, and vegetables. Lactose found in milk, dairy products like cheese, butter. Maltose found in malted foods and beverages such as milk and beer. B. Complex carbohydrates. Complex carbohydrate consist of oligosaccharides and polysaccharides, which include starches and fiber. They take longer to digest and provide a more sustainable energy release. One, starches. Grains, whole grains such as brown rice, oats, barley, whole wheat products. Legumes, example beans, chickpeas, and beers, tubers and root vegetables, potatoes, sweet potatoes, yams, carrot, etc. Corn, both as a vegetable and as a grain. To fiber, soluble fiber found in oats, barley, nuts, seeds, beans, some other fruits, vegetables, etc. Insoluble fiber found in whole grains, nuts, seeds and vegetables. A balanced diet should emphasize complex carbohydrates from whole grains, fruits, vegetables, legumes, nuts, seeds, while limiting the intake of simple sugars and refined grains. This approach ensures adequate fiber intake, sustainable energy levels, and overall nutritional well-being. Functions of carbohydrates. Detail going on. Carbohydrates play a crucial role in various physiological processes and are essential for maintaining overall health. Here are key functions of carbohydrates in the body. 1. Energy production. Primary energy sources. Carbohydrates are the body's main source of energy. During digestion, carbohydrates are broken down into glucose, which is then used by cells to produce ATP. The energy currency of the cell. Immediate energy, simple carbohydrates provide quick energy as they are rapidly absorbed and metabolized. Second, energy storage, glycogen storage. Excess glucose is converted into glycogen and stored in the liver and muscles. Glycogen can be quickly mobilized to meet energy needs during physical activity or between meals. Three, protein sparing, preserving muscle mass. Adequate carbohydrate intake prevent the breakdown of proteins from energy, allowing protein to be used for growth, repair and maintenance of tissues. 4. Fat metabolism, preventing ketosis. Carbohydrates are necessary for complete oxidation of fats. In their absence, the body produces ketone bodies, which can lead to ketosis if accumulated excessively high brain function. Cognitive function. Glucose is the primary energy source for the brain. Adequate glucose levels are essential for maintaining cognitive function and including memory, attention, learning. Six, digestive health. Fiber. Dietary fiber, a type of carbohydrate, aids in digestion. 5. Promoting regular bowel movements, preventing constipation and maintaining a healthy gut. Microbiome. Seven, cellular communication, cell signaling. Carbohydrates are involved in cell to cell recognition and communication through glucoproteins and glycolipids and cell surfaces. 8. Structural role. Building blocks. Carbohydrates contribute to the structural integrity of cells and tissues. For example, cellulose provides structural support. 9. Immunofunction. Immunoresponse. Certain carbohydrates are involved in the immunoresponse. Glycans or cell surface play a role in recognizing pathogens and facilitating immunocell interactions. 10. Regulation of blood sugar levels, blood glucose control. Carbohydrates with a low glycemic index, example whole grains and legumes, help regulate blood sugar levels by providing slower, more sustainable release of glucose into the bloodstream. 11. Satiety and weight management. Feeling full. Fiber-rich food promote a feeling of fullness and help control appetite, which can aid in weight management. 12. Lactose for infant nutrition. Lactose in milk, a disaccharide found in milk, is an important carbohydrate for infants. Provide energy and promoting the absorption of calcium and other minerals. 3. Energy. Contents including unit of energy, kilocalories, BMR, basal metabolic rate, then factors affecting basal metabolic rate. Energy and its unit. Kilocalories. Definition of energy. Energy is the capacity to do work. It exists in various forms such as kinetic, potential, thermal, electrical, chemical, nuclear energy. In the context of nutrition, a human Physiology. Energy primarily refers to the energy derived from food and used by body to perform various functions including metabolism, physical activity, and maintaining body temperature. Unit of energy, kilocalories, is a unit of energy commonly used in nutrition to quantify the energy provided by food. 1 kilocalories is defined as the amount of energy required to raise the temperature of 1 kilogram of water by 1 degree Celsius. Defined by equation, 1 kilocalorie is equal to 1000 calories. 1 kilocalories is equal to 4.184 kilojoules. Second, calorie versus kilocalorie. In dietary context, the term calorie is often used interchangeably with kilocalorie when referring to the energy content of food. Calories on food label and in nutritional information typically mean kilocalories. Importance of kilocalories in nutrition. 1. Energy balance. The balance between kilocalories consumed through food, beverages, kilocalories expended through metabolic process and physical activities determines by weight. Consuming more kilocalories than expended leads to weight gain, while consuming fewer leads to weight loss. Second, basal metabolic rate, BMR. BMR is the number of kilocalories required to maintain basic physiological functions at rest, such as breathing, circulation, and cell production. BMR varies based on factors such as age, sex, weight, and muscle mass. Three, total daily energy expenditure. TDEE includes BMR plus the energy expended through physical activity, digestion, and other daily activities. Understanding TDEE helps in planning diets for weight management, athletic performance, and overall health. Energy contents of macronutrients. Different macronutrients provide different amount of energy per gram. 1 carbohydrates. 1 gram of carbohydrates is equal to 4 kilocalorie. Second, proteins. 1 gram of protein is equal to 4 kilocalories. Three, fats. 1 gram of fat is equal to 9 kilocalories. 4, alcohol. 1 gram of alcohol is equal to 7 kcal. Practical applications. First, diet planning. Knowing the kilocalories content of foods helps individuals. And nutrients design. Balanced diets that meet energy needs without exceeding them. Second, food labels. Food labels provide information on the kilocalories content per serving, aiding consumers in making informed dietary choices. Three, weight management. Maintaining kilocalorie intake is crucial for maintaining and managing body weight. Diet can be adjusted to create a caloric deficit for weight loss or a caloric surplus for weight gain. The kilocalories is a fundamental unit of energy in the context of nutrition, representing the energy contents of food and its availability for bodily function. Understanding kilocalories and their role in the energy balance essential for maintaining a healthy lifestyle, managing weight, and optimizing physical performance. Basal metabolic rate (BMR). Definition: BMR is the amount of energy expended by the body at rest to maintain vital physiological functions such as breathing, circulation, cellular production, nutrient processing, and maintaining body temperature. It represents the minimum energy required to keep the body system functioning while at rest in a neutral environment and in a post-absorptive state when the digestive system is inactive. Calculation of BMR. Several equations can be estimated BMR with the first Harris-Benedict equation and the second Mifflin-St. Jeor equation being the most commonly used. One Harris-Benedict equation revised on 1984 for men. BMR is equal to 88.362 plus 13.397 into weight in kilogram plus 4.799 into height in centimeter minus 5.677 into age in years. For women, BMR is equal to 447.593 plus 9.247 into weight in kilogram plus 3.098 into height in centimeters minus 4.330 into age in years. Second, Mifflin equation. For men, BMR is equal to 10 into weight in kilogram plus 6.25 into height in centimeter minus 5 into age in years plus 5. For women, BMR is equal to 10 into weight in kilogram plus 6.25 into height in centimeters minus 5 into age in years minus 161. Activity multiplier. To estimate total daily caloric needs, multiply the BMR by an activity factor based on the individual's level of physical activity. Sedentary, little or no exercise, BMR into 1.2. Lightly activity, light exercise including sports 1 to 2 days per week, BMR into 1.375. Moderately active, moderate exercise including sports 3 to 5 days week, BMR into 1.55. Very active, hard exercise sports 6 to 7 days a week, BMR into 1.725. Super active, very hard exercise, sports and physical, job or 2x training, BMR into 1.9. Example calculation. Let's calculate the BMR and daily caloric needs for 30 years old woman who weighs 70 kilogram, is 165 centimeter tall and is moderately active. Calculate BMR by using Mifflin equation. BMR is equal to 10 into 70 plus 6.25 into 165 minus 6 into 30 minus 161. BMR is equal to 700 plus 1031.25 minus 150 minus 161. So total BMR is equal to 1420.25. Then apply activity multiplier, daily caloric needs, BMR into 1.55. The daily caloric needs is equal to 1420.25 into 1.55. So daily caloric needs is equal to 2201.39. So this woman need approximately 2201 calories per day to maintain her current weight with a moderate level of activity. Importance of BMR. 1. Weight management. Understanding BMR is crucial for weight management. It helps in determining the total daily energy expenditure when combined with physical activity levels. Second, nutritional planning. BMR provides a baseline for developing personalized dietary plans to ensure adequate energy intake for weight maintenance, loss or gain. Three, medical assessment. BMR measurement can be used in clinical setting to assess metabolic health and plan nutritional support for patients. Increasing BMR. While BMR is largely determined by genetic and physiological factors, certain lifestyle changes can help increase it. 1. Increase muscle mass. Engaging in resistance training and strength building exercise can increase muscle mass, which turn raise BMR. Second, regular physical activity. Regular aerobic exercise can boost overall energy expenditure and slightly increase BMR. Three, healthy eating. Consuming a balanced diet rich in protein can support muscle maintenance and growth, contributing to the higher BMR. For stay hydrated. Proper hydration is essential for optimal metabolic function. BMR is key indicator of the minimum energy required to sustain essential physiological process at rest. Understanding and calculating BMR is vital for effective weight management, personalized nutrition planning, and overall health. By considering factors such as age, sex, body composition, and lifestyle, individuals can better manage their energy intake and expenditure to achieve their health goals. Factors affecting BMR. Intrinsic factors. 1. Body composition. Lean body mass, which means muscle tissue is more metabolically active than fat tissue. So individuals with higher muscle mass tend to have a higher BMR. Then body fat percentage. Fat tissue has a lower metabolic rate compared to muscle tissue. So higher body fat percentage may lead to a lower BMR. To age, BMR tend to decrease with age due to a decline in lean muscle mass and changes in hormonal levels, particularly affect the age of 30 or 40. Three sex. Men generally have a higher BMR than women due to higher muscle mass, lower body fat percentage, and differences in hormone levels such as testosterone. For genetics, genetic factors can influence metabolic rate, including the efficiency of enzymes involved in energy metabolism and hormonal regulation. 5. Hormonal levels. Thyroid hormones T4, thyroxine and T3 produced by the thyroid gland play a crucial role in regulating metabolism. Thyroid disorders can significantly affect BMR. Stress hormones. Hormones such as cortisol and adrenaline can temporarily increase BMR during stressful situation. Six. Health conditions. Illness, infections and chronic diseases can affect metabolic rate and lead to alterations in BMR. Fever, for example, can elevate BMR temporarily. Extrinsic factors. 1. Physical activity. Exercise and physical activity can increase energy expenditure and temporarily elevate BMR. Regular physical activity, particularly strength training, can also contribute to an increase in lean muscle mass, thereby raising BMR in long term. Second, environmental factors. Temperature. Exposure to cold temperature can increase BMR as the body expenditure energy to maintain its core temperature through thermogenesis. Conversely, exposure to extreme heat may slightly decrease BMR. Altitude. High altitude can increase BMR due to increased energy expenditure required for breathing and maintaining oxygen saturation in the blood. Three natural status: caloric intake, severely restricting calories, or following very low calorie diet can low BMR as the body enters a state of energy conservation. Macronutrient composition: protein and carbohydrates have a higher thermic effect compared to fats, meaning they temporarily increase energy expenditure after consumption. For sleep. Sleep deprivation can affect metabolic rate and hormonal regulation, particularly leading to alterations in BMR. Five, medications. Some medications such as certain antidepressants, steroids, and thyroid medications can affect metabolic rate and BMR as a side effects. BMR is influenced by a complex interplay of intrinsic factors such as body composition, age and genetics, and extrinsic factors such as physical activity, environment and nutrition. Understanding these factors is crucial for individuals seeking to manage their weight, optimize their metabolic health, and make informed lifestyle choices. Four, significance of BMR in nursing. Basal metabolic rate is a critical concept in nursing as it reflects the number of calories required to keep the body functioning at rest. Here are key points illustrating the importance of BMR in nursing. First, individualized care. Understanding a patient BMR allows nurses to tailor nutritional plan to meet individual energy needs, promoting optimal health and recovery. To weight management, BMR is fundamental in creating weight loss, gain, or maintenance plan. Nurses can use BMR to calculate daily calorie needs and guide patients accordingly. Three, nutritional assessment. BMR is core component of comprehensive nutritional assessment. It helps nurses determine whether patients are receiving adequate energy intake relative to their metabolic demands. For monitoring metabolic changes, nurses can track changes in a patient's BMR to monitor metabolic health, which is particularly important for patients with metabolic disorders or those undergoing significant weight changes. Five, disease management. BMR knowledge is essential for managing conditions like thyroid disorders, where metabolic rate alterations are common. Nurses can adjust care plans based on these changes. 6. Critical care. In critical care setting, accurate BMR assessment is vital for determining the energy requirements of patients who are often in catabolic state due to trauma, surgery, severe illnesses. 7. Geriatric care. Understanding BMR is crucial elderly patients as metabolic rate decreases with age. Nurses need to adjust dietary recommendations to prevent undernutrition or overnutrition. 8. Pediatric care. In pediatric nursing, BMR helps determine appropriate caloric intake for growth and development, ensuring children receive adequate nutrition. 9. Patient education. Nurse educate patient about their energy needs based on BMR, helping them understand how different factors, age, sex, weight, activity level, influence their caloric requirements. 10. Preventing malnutrition. By assessing BMR, nurses can identify patients at risk of malnutrition and intervene early with appropriate nutritional support, reducing the risk of complications and improving outcomes. Knowledge of BMR empowers nurses to provide more precise and effective nutritional guidance, contributing to better patient care and health outcomes. Conclusion. Understanding carbohydrates is essential for nursing professionals as they play a critical role in providing energy for bodily functions, supporting patients' nutritional needs, and managing conditions such as diabetes and metabolic disorders. Nurses must educate patients about the importance of consuming balanced diet rich in complex carbohydrates from sources like fruits, vegetables, and whole grains to promote optimal health and well-being. Additionally, maintaining carbohydrate intake and blood glucose level is vital for patients with diabetes to prevent complications and maintain stable blood sugar levels. By incorporating evidence-based nutritional guidance and personalized care plans, nurses can empower patients to make informed dietary choices and achieve better health outcomes. Thank you. Have a wonderful day.